Nurses Training, The Medication Pass and Things to Remember by Elizabeth L. Holden, LPN. What does this say? I'm sure quite a few of you do not remember this, or if you do, it's a nightmare out of wherever. But the doctor's written scripts are really difficult to read, not to mention all the shortcuts and everything else. So we're trying to eliminate this. That's why we're going modern. The modern day's easiness. Computerized prescriptions, computerized medication pass, and remembering what you were taught in school. Doctors are human. They make mistakes too. The computer does not realize the size of your patient. And the pharmacy has different parameters than patient's doses when ordering and stocking. They're going to put what they can get the best price of and go from there. It's not what the actual doses are for every script. The reason for this meeting, I've been told this facility is having an increase in medication errors. Originally, the computers were brought in to aid due to the difficulties in reading the doctor's writing. Now there's problems with wrong dosages and passing to the wrong patients. We are here to fix the issue and remind you of things that you already are aware of but are not using. Simple fixes to get you on top of your game. The computerized prescriptions that allow us the ease of reading what the doctor intended instead of guessing at it. The necessities of the prescription are mandated into the program. The doctor must put the name of the drug, the dose, the form, the route, the frequency, and a signature, and of course the patient's name. You should also check for allergies. Ultimately, we need to double to triple check everything. We don't ask, then it falls on our license, so do not assume. The 6 rights. The right medication, the right dose, the right patient, the right route, the right time, the right documentation. There's even a 7th one, and that's the right to refuse. These came out of the Fundamentals of Nursing by Potter and Perry. It's a first-year nursing book, and I'm sure you remember drilling those 6 rights into your head. Medication doses. If it doesn't not seem the right, calculate it. Ask the doctor if that was what he truly wanted to give to the patient. Look it up in the drug book, setting at the nurse's station or in your cart. Remember, you are responsible for you and the doctor and the pharmacy. Nurses catch the mistakes of everyone. Pay attention and trust your gut instinct. Calculating medication doses. If you have medication but it's not the dose that is prescribed, the use of the calculations to realize the amount of the pills needed for the pass. You take the dose ordered divided by the dose on hand, and that equals the amount on hand and the amount to administer. Say the doctor ordered 60 milligrams of prednisone and there is only 10 milligram tablets, so 60 divided by 10 equals 6 tablets. Remember, we can always work our way through problems. If by chance there is only liquids, call the doctor for clarification on a possible change. Computerized med passes. Computerized charting was created to make life easier. There are still problems with it like everything else. The bugs need to be worked out of it. Pass your meds like you were taught in school. Triple checking each medication to each patient. Computers have a chance of changing pages to different patients, so always check your screen to make sure it's the right patient that you're working on. Village keeps us practicing and our patients getting better. Which one of these would you like to read day in, day out, 8 hours a day? I'm sure you're going to pick the computer because it's easier to handle and it also has a backup for looking up things. Technology. There is problems with it, but it makes it so much easier. Remember, questions and following what we are taught will get us further and more safely. The 6 rights, triple checks, calculations, confirmation of a patient that is being passed to. It is a struggle to change, but the benefits outweigh the hassle. Questions? Is there any questions from you? Remember, questions solve problems and make things easier.